Hi viewers, myself Dr. Abhilash. In this video, we are going to discuss about what is phimosis, what complications or what sequences can happen if phimosis is not treated, what are the treatment options for phimosis, how exactly the surgery is going to be, and what is going to be the post-op recovery that is to be taken. So to start with, let's discuss about what is phimosis. The skin covering the penis is referred to as foreskin. Everyone will be having foreskin in excess. If the foreskin opening is small enough to such extent that if the patient is unable to retract back the foreskin, that condition is referred to as phimosis. In most of the conditions, phimosis is congenital. That is, congenital means extra foreskin with the narrow opening of the foreskin will be present right from the childhood, means that from the birth also. So in such conditions, mostly parents should give attention to their male child whether they are able to retract back the foreskin or not, or are they able to see the urinary opening on the penis. If they are not able to see the urinary opening, then it is called as complete phimosis, for which attention is to be taken as early as possible. What happens if attention is not taken at the right time? Means, so what are the complications that can happen if phimosis is not treated at the right time? So to start with, hygiene purposes. How it affects? Just like the sweat that is produced over the skin. In the same way, we do have some secretions which is referred to as smegma that gets deposited between the penis and the foreskin. If the person is not able to retract back the foreskin, so that smegma gets deposited for long durations, thereby it may cause symptoms like itching and it may cause pain while urinating, and in advanced cases it may lead to some white discharge coming out from the opening of the penis. So in such conditions, that may lead to some urinary tract infections also. So for the first reason, it will be hygiene purposes. Apart from the hygiene purposes, if the same child, if left untreated, if it grows into an adult, there may be few disturbances during the sexual intercourse. Maybe there will be small cracks that will be developing at the time of intercourse. Apart from it, the sexual pleasure also differs because the receptors for orgasm or sexual pleasure will be lying on the penis. In these people, just because the skin is covering the penis, the sexual receptors are not exposed, thereby there will be some limitations in the amount of the sexual pleasure. Apart from these two factors like hygiene purposes and sexual pleasure, the main concern for surgeons will be adhesions. What are these adhesions means? We'll just discuss about the few examples. If anyone goes to a post office and if he wants to stick a stamp, and he finds nowhere he can find a gum, what he'll be doing? He'll be using the natural gum, that is the saliva, and he'll be sticking it. Saliva is not a gum, but still it is acting like a gum. In the same way, every body secretion has a tendency to act like a gum. In the same way, if this smegma, the secretions that are getting deposited between the penis and foreskin, if left untreated for long durations, these may act like a Fevicol bonding, and these create a strong bonding between the penis and the foreskin. What happens if these bonds are developed? The person won't be able to retract back the foreskin, and once after opening, there will be great difficulty during the surgery to release these adhesions. How difficult it is going to be? Let's discuss with a small example. For example, a small wooden table, and over it we have placed a newspaper, and we'll be able to lift up the newspaper daily and we'll be able to keep it. If at all there is some accidental spillage of some coffee or tea over the table, what we immediately do? We'll be placing the paper over the table and we'll be leaving it as such. If that paper is left on the table for 2-3 days, and then we come back after 3 days, and if we try to lift the paper, will we be able to lift the paper? We may not be, because there is some gum or the coffee or tea that has spilled, the liquid may act like a gum, thereby the paper will get densely stuck to that wooden table. In such cases, however precautions we take to remove the paper gently, we won't be able to remove the paper as easy as when it was dry, because it has already densely stuck. In the same way, This phimosis, if left untreated for long durations, it may get densely stuck, thereby causing difficulty during surgery, because we have to gently separate the foreskin that is densely adherent to the penis during surgery. Apart from these factors, if this phimosis is left untreated for longer durations, in the old age, it may lead to conditions such as cancer also. So to prevent all these complications from happening, be it hygiene purposes, urinary infection, itching, sexual intercourse, and the adhesions which may form, and in exceptional cases for cancer also, to prevent all this from happening, we may advise surgery as early as possible to the patients who are diagnosed with the phimosis.